Thank you very much, RVML, for hosting this event. All right, so welcome and thank you for coming. Tonight, I just want to say that I'm not going to be talking about specific plans. I'm a licensed insurance broker. I represent every plan in Jackson County, with the exception of a small handful of Part D prescription drug plans that I do not represent, and a small handful of Medicare supplement plans that I don't represent. But I vetted the companies that I do represent, and that's why I represent them, because I think they're good companies. They've been around a long time. They stand behind what they say. So that's what I look for. But I do represent every Medicare Advantage plan in Jackson County except one that is only available to people with Medicare and Medicaid. But I represent one of those, but not the other. So there you have it. I follow the Medicare rules carefully because I never want anything to come back to haunt my clients. You know, that I did something wrong and then they end up with some backlash from that. So I'm very careful. And that's why tonight I'm not going to talk about specific plans. I did hand out, there is a handout you can have. It does a good job. I'm using it because it does a good job with an overview of Medicare without getting too much into the weeds. It gives you the picture I'm going to give you. It is by a company called Atrio, which has Medicare Advantage plans in Jackson County, but I am not here representing Atrio. I'm an independent agent. I'm here to talk about Medicare and not even Medicare plans, okay? But we'll talk about types of Medicare plans. Okay, so I call this the A, B, C, and D of Medicare because those are the four types of plans that you can have, that Medicare consists of, let's say. So this is me. I'm a licensed agent. I've been doing this for several years. I started getting my license in 2023. I retired from the San Francisco Department of Public Health and worked there for 10 years. And when I went to retire and looked at Medicare, I went, what? I have a doctorate, right? And I was totally baffled by what I saw. And I said, if this is baffling to me, and I'm used to studying and doing research, and right, what are people doing out there? They're ending up making mistakes, paying late enrollment penalties, doing things that shouldn't have to happen, in my opinion, if you have some help. So I decided right then and there, I'm going to help other people with this. So then I consider it an act of resistance, to tell you the truth. So I help you understand Medicare first. That's what we're here to do tonight. I help you enroll in Medicare if you choose to do that. If you enroll with me, I get a commission from the insurance company that you enroll with, but you pay nothing for my services. No one pays for my services under any circumstances. I don't take gift cards. I don't take anything. You come to me because I have some information you can use. And of course, you know, I want to help you solve a problem, and that's enrollment usually solves a problem for you, and then I do get a commission. These commissions are regulated, so they are the same across the companies, meaning I have no horse in the race. I'm just looking for you the best plan I can match you with where you are, given your health needs, how you like to get your care, how you like to pay for your care, how you like to interact with insurance, how you like to interact, where your doctors are, what medicines you take, and so on and so forth. So that's what I'm looking at. And I don't work for insurance companies. I want to be clear. I work for you. If you're my client, I work for you, not for the carrier. Okay? And that's the way the system is designed. So I'm an independent agent. As a result, I'm able to compare all the plans I represent on the market. And I already talked about the extensive plans that I represent. I have a team of professionals in a back office called Spark, and they are concierge navigators. So if my client, you know, calls their member services number on the back of their card and makes an effort to solve a problem like a billing error or I can't get authorization. I had a 93-year-old woman had a stroke and was admitted to Sante Rogue Valley in Medford Hospital. There for several days. They went to discharge her and said that her Medicare Advantage plan would not pay for physical therapy. So she made her effort, right? She called the people on the card, and her friends did. People tried to help her out. Good evening. And and she finally called me. 20 minutes later, my navigators had her admission to a rehab facility and approval for physical therapy.
Wow.
So that's how we roll, because that's why I get a commission, is to support my clients after enrollment. As well as through enrollment and before enrollment. So that is what I do. Whenever you have questions, you know, I can help you, my navigators can help you, so you have lots of support with your healthcare. And I definitely cut through the noise, and there is a lot of noise. So let's start with the parts of Medicare. Part A is what we all have. Those of us who are retired, when you reach 65, or you are disabled, and you're on Social Security disability for 24 months, then you're eligible for Part A Medicare, and that is hospital coverage. Okay, so it's anytime you're spending the night somewhere for medical care, that's generally hospital, even if it's a nursing home or a rehab facility or an acute hospital. Right? That's considered inpatient care, and that's what Part A covers. Part A also covers hospice care. So Part B helps cover medical costs. Your doctor, your physical therapy, occupational therapy, your lab work, your x-rays, anything that your doctor might refer you to, a specialist, and so on. So medical care is non-hospital, non-inpatient medical care, and that's what Part B is designed to cover. Part C is what we commonly know as Medicare Advantage. And these plans have become very political, and people have a lot of opinions about them. Okay? But I can tell you that many people who enroll in those plans really like them. So if the plan is the right fit for you and it meets your needs, it can work very well. And you'll hear horror stories, and you'll hear good stories. So I hear all of them. Okay, so I don't have an opinion particularly, okay? But I do know that Medicare Advantage plans are very important for people who don't have don't have the ability to purchase a Medicare supplement plan, right? So Medicare Advantage is very helpful for those people.
For which people?
For people who don't have the means to buy a Medicare supplement plan, right? But also, they're very effective, and they provide things that traditional Medicare does not do. So they have advantages. They have to cover everything that Part A and Part B cover. They have to, by contract with the federal government, cover everything Part A and Part B includes. And they each do that differently. And that's where I get to know you, get to know your needs, what works best for you, and then match you. If you're interested in Advantage plans, I try to match you with what's in your area that meets that. But I also represent supplement plans, which we'll talk about, and I represent Part D prescription drug plans. Most Medicare Advantage plans include Part D. They include prescription drug coverage, but some don't. So that's how A, B, C, and D. And Medicare is individual federal health insurance. It is health insurance. Okay, so like all insurance, it's about risk management. How comfortable are you with risk? And how much risk do you want to carry every day? That's the question of any insurance. You know, you get your car insurance, your home insurance, your renter's insurance. Question is, how much risk can I bear? And if I can bear a lot of risk, I'll buy low coverages, and just see what happens. But some people don't like that. So again, very individual, what you are comfortable with. Yes?
So you said that Part C is Medicare Advantage plans, but where does Medicare Supplement?
We'll be talking about that. Yeah.
Oh, okay.
Yeah, so as I walk through this, you'll get the whole picture, and we will talk about supplements. They're important. They're just very different. And so they have a different function, and we'll see how that all fits together. Okay, so who can get Medicare? Within 3 months of turning 65, that is 3 months before, 3 months after you turn 65. So we have 7 months to enroll in Medicare. And unless you're working, if you're working, you can delay Part B enrollment, which we will talk about a little bit more detail later. If you're younger than 65 but have a qualifying disability, you can get Medicare. And or if you have end-stage renal disease, you automatically, or Lou Gehrig's or ALS, people automatically with those diseases qualify for Medicare. When can you sign up? You can sign up 3 months before your 65th birthday, during the month of your 65th birthday, 3 months after your 65th birthday. And what I mean by that is to avoid penalties. This is your time frame for signing up. Yes?
Oh, what
He
happens
just turned
if you did?
66.
Okay, so if you are not enrolled in Part B and you're not working, you haven't had
He
coverage,
had to retire, yeah.
yeah, then you had retired?
Well, I retired in January
Of last year.
of last year,
Okay,
of this year,
of 25?
This year, 25, yeah.
25. 'Cause we
You're
had
a little bit late.
homeschool,
You'll
yeah.
probably have a penalty for Part B.
Okay.
Yeah, so we'll talk about that as we progress. But yeah, so this is exactly the kind of thing that I help people work with and avoid. Let's do it so that you don't, because these penalties are lifetime penalties. Once you incur it, you pay it for life. Okay, and that includes Part D penalties and Part B penalties. And the reason for that is because it's insurance. And so if we all wait till we're 83 and have huge medical problems and we enroll, there wouldn't be Medicare, right? It needs the whole pool of us, the younger of us at 65 and the older of us, to kind of help each other through, right? So that's the nature of all insurance, car insurance, right? All insurance works on the group model. And you have to have differences in that group, or else you can't support the insurance, okay? Okay, so original Medicare, let's start there. Original Medicare is Parts A and B, okay? Parts A and B, hospital and medical. That's what we call original Medicare. Again, Part A, hospitalization, and skilled nursing, hospice, home health. Part B, routine care, doctor visits, preventive services, home health providers providing actual care. Original Medicare includes deductibles and coinsurances, and you'll see those. So it is not free. There is no free Medicare. We get Part A without paying a premium, but it is not free. It has a deductible every year. And so there are co-insurances. We're always sharing the cost of our insurance. And people say, well, I get it free. No, you're paying. You just don't see it. You're paying it out of your Social Security. You paid it in payroll contributions while you worked, the whole time you worked, right? So there's no free Medicare. And I think, in fact, agents aren't even allowed to use the word free. We have to eradicate it from our vocabularies, okay? There's no free Medicare. Because, it's kind of an incentive. So let's look at the cost of original Medicare. Part A, premium is $0 if you have worked 10 plus years and paid taxes, you or your spouse. So 10 plus years, it's 40 quarters, and you have to have contributed to Medicare during that time.
Is there any way we can get sent to us?
I'm not allowed to send my slides, but you can take photos.
What? No, what?
I'm not allowed to send my slides out. Yeah, Medicare, it's against the rules. Yeah,
Yeah.
but you can take photos.
Is this in?
It is in, I don't know if the cost is in there. That's a good question. Yeah, yes, Joy.
The other part is that this is being recorded.
It is being recorded, so you can watch it again. Yeah, RVML posts all these groups online,
Oh, great.
so definitely. Yeah, thank you. That's right. Yes, very helpful. Okay, so Part A, hospital insurance has a $0 premium. It has a deductible of $1,676 in 2025. So that's for the year. That's an annual deductible. And it has a $419 per day inpatient hospital charge for days 61 through 90, if you're hospitalized for an extended period of time. And $838 for every day after 90 days that you're in an inpatient hospital. So that's Part A. So you can see it's not free. There are co-insurances and co-payments, and that's for Part A. Part B has a monthly premium. In 2025, it was $185. I believe I saw, I haven't had a chance to validate this, but I believe I saw that in 2026, it's going to be $202.90 a month. So I heard $206.50, but yesterday I was actually looking at things and it seemed to be very much firmly saying 202, but I haven't, 90, but I haven't had a chance to check on Medicare.gov. But anyway, it goes up every year, and usually there is some offset in the COLA to Social Security for these costs. Your 2025 per year deductible for Part B is $257. I believe this is going to $288. This 288, the deductible for Part B. So that's an annual deductible. So if you want to be on Original Medicare, these are the costs of Original Medicare. And then the other cost is that of the costs that you incur for medical and hospital expenses, in addition to that, you pay about 20% of that. So Original Medicare pays about 80% of what it covers. And then you, as the holder of the policy, pay the other 20% of excess charges, they call it. Yes?
So the $257, that's what you would pay, and then after that, it pays.
After that, it pays 80%.
80%.
And then you pay.
So on the $257, it doesn't pay anything.
That's correct. That's a deductible. That's exactly how to understand a deductible. You pay first until you hit that deductible. And then they cost share with you to a certain amount. Actually, Original Medicare does not have a maximum out of pocket, so it can be as high as it can be, and you're responsible for 20%. So that's an overview of Original Medicare. So here's what we have. We have Parts A and B, which cover roughly plus or minus 80% of what they cover. And then we have this gap of plus or minus 20% that you hold responsibility for if all you have is A and B. Okay? And you can do that. You can have A and B and nothing else. And people think that's great because they think it's not costing very much until something goes wrong, and then they have this 20% to work with. Okay? And so for that, what do you do? And there are two options. One is you can get a Medicare supplement. So this was the question. What about Medicare supplement plans? So a Medicare supplement is a private insurance policy that you buy from an insurance carrier. They are age-based, meaning as you age, they go up every year. And they do not cover anything that Original Medicare doesn't cover. So no, for the most part, there are a couple that'll give you a gym membership, but no dental, no vision, no hearing, no prescription drug, okay? So Original Medicare doesn't cover any of those things. So neither does the Medicare supplement. And I'll talk about the costs of those in a minute. So again, it's about how you like to get your care, how you like to pay for your care, how you like to interact with your care, your insurance companies, and so on and so forth, okay? So the big advantage of Medicare supplement plans is that you have no network. You have just whatever takes Medicare supplement plans, okay? They're required to, basically. They can decline Medicare patients. They can say, well, we're not adding any Medicare patients to our practice, but if they take Medicare as a rule, then they will take your Medicare supplement plan. and it will cover the 20% or so that Medicare leaves on the table. Okay, that's all they do. Now, that's not bad. That reduces your risk a lot, but they also leave a lot out, like, you know, dental and prescription drugs, right? So if, generally speaking, if you choose option 1 and you get a Medicare supplement plan, then you are also required to purchase a Medicare prescription drug plan. And that is true whether you take prescription drugs or not. Why? Because it's insurance. And so if we wait until we're sick and we have, 10 drugs, and then suddenly we all want to enroll in a Part D plan, there will be no Part D coverage. It could not be sustained, right, by the carriers. So we all are required to enroll in it. If we don't enroll in it, there are certain time frames, which I'll touch on but won't, drive into because that's the weeds, trust me. But that's why you want to work with an agent, a local person who can help you navigate this. But you do incur a late enrollment penalty for life if you don't enroll on time in a Medicare Part D prescription drug plan. So even if you get a supplement and you think, okay, I'm good, you really should add a Part D plan. And there are options for that, but you should have one. I'm saying that. It's okay, so people say, well, do I have to? Well, no. But if you need it later, you could not be able to get it because you could have a $100 late enrollment penalty a month. And then maybe your prescription drug plan is, $40. Now your prescription plan is $140, and you haven't even paid for your meds yet, right? Your co-pays, yeah? So you don't want to go there. I think it's much better to work out some sort of Part D prescription drug coverage. And if you don't, there are ways to do it if you don't take prescriptions, but you still ought to have it. Okay, option 2 for covering this gap is a Medicare Advantage plan. Most of them have prescription drug coverage included. So it's a separate plan, but it's part of the overall plan that the carrier provides.
The deductibles, A and B, for the Medicare Advantage.
So generally speaking, that you do not pay those deductibles on Medicare Advantage plans, but Medicare Advantage plans can have their own deductibles. So a Medicare Advantage plan can have a medical deductible or health deductible, and they can have a drug plan deductible. Okay, but Medicare Advantage plans are creative, they're competitive, so they have if you have only low-tier drugs, then they don't count toward the deductible, right? But when you get into higher-end brand-name drugs, they start to count toward the deductible, and then you have to pay the deductible, right? So there's different ways that they work, but they are definitely. You could say that this option 1 is a pay ahead. You pay a premium every month for your supplement and your Part D plan, and then you get care when you need it throughout the year, and there you are. You're good to go, right? And you could say option 2 is a pay-as-you-go plan, where you may have a small premium, you might have a deductible here or there, but you don't actually pay until you see the doctor and you have a copay. Or you go to a specialist and you have a copay. Or you go to an ambulatory surgery center for your hip replacement and you have a copay. Okay? So that's one of the differences between them. Medicare Advantage plans work with networks. So, many of us, when we retired, I came out of Kaiser, HMO in California, and then after that I had Blue Shield of California, which was a PPO. So those are network-based plans, and that's what my employer provided. So private commercial plans are largely similar to Medicare Advantage plans, actually. We're kind of used to those, but you do have to kind of work the network, right? You have to know what doctors and what facilities in your area are in the network that your plan uses. And you have to kind of either with a health maintenance organization stay within that network, or with a preferred provider organization, you can go out of network. You just pay a bit more. So we'll talk more about that. But, so, with a supplement, no network. Anybody who takes Medicare. With an Advantage plan, you're working with networks. And so some people pay for choice, right? And then some people really kind of like a network. And in Jackson County, we really have two major health plans, or two major medical groups. We have Providence and we have Asante. So if you have a Medicare Advantage plan that takes Providence and Asante, you pretty much have the land here. There's not a lot that you can't go to in network with that kind of plan. There are some independent doctors who don't carry all the Advantage plans. I mean, there are always limits. So I don't want to be here preaching Advantage plan. I'm not, because supplements are great too. They just function differently, and it depends on what works for you. So, okay. So, original Medicare with a Part D prescription drug plan and or a Medicare supplement is option 1. The prescription drug plan helps pay for drugs. The Medigap or Medicare supplement here fills the gap between original Medicare and billing and your expenses. And then you might have extra insurance for dental, vision, hearing, other needs that you may have. But those would be separate policies from these. Okay, here's how I like to describe a Medicare supplement. There are 10 standardized Medicare supplement plans. So if we think of original Medicare as the car, okay? And attached to the car is a trailer. And we think of the trailer as the Medicare supplement. Where the car goes, the trailer goes. Where the car does not go, the trailer does not go. So the trailer, the Medicare supplement, no matter what plan you have, will not pay for anything not paid for by original Medicare first. So your doctor bills original Medicare, they pay their portion, and then they bill the Medicare supplement, which pays its portion. That's how they work. It's plain and simple. Very straightforward. So the other advantage of Medicare supplements is you don't usually deal much with them because they're so straightforward. They just pick up what Medicare doesn't, okay, of what Medicare covers. And they don't do anything Medicare doesn't cover because they don't go where original Medicare doesn't go, okay? So to me, this is the best sort of, metaphor, if you will, or example of kind of how it works. So you do get coverage nationwide. You have no provider network, so any doctor in the country who takes Medicare. There is no drug coverage, dental, hearing, or vision. There's no medical underwriting under certain circumstances. So if you choose a Medicare supplement plan within 6 months after you lose coverage, so that's you retire, you turn 65 and don't have insurance, creditable insurance coverage, you have basically 6 months from when you turn 65 to purchase a Medicare supplement plan with no medical underwriting. So no pre-existing conditions, no questions asked, you can get the plan for 6 months. Now somebody said to me, well, that's not right. I should be able to wait with a free pass until whenever I want. Well, think about it again from the point of view of insurance. If we all wait till we're very old and infirm to apply for and they have to give us a supplement, supplements would not exist. They wouldn't be supportable. They wouldn't be sustainable because the need would be so great. So they also rely on a group that has some age diversity and health diversity in order to support themselves. Okay, so, car and trailer. There are 10 standardized plans, and they each have a letter associated with them. So, here they are. Okay, Plan A, B, C, D, F, G, K, L, M, and N. It does not matter who you buy a plan from. A Plan A is a Plan A is a Plan A. A Plan F is a Plan F is a Plan F. It doesn't matter the company that carries it. They are all regulated by the federal government, by CMS, by Medicare, and they cover exactly the same way that they within their group. So a Plan F was the highest, sort of the gold standard for a long time. But for people who became eligible for Medicare after January of 2020, we can't buy Plan Fs. So it went away. Well, it's still there. People have it. but they are paying a lot for it. They're paying a high premium. Why? Because the group has gotten much smaller and older and sicker. Okay? So the premiums are going up and up for Plan F. So actually, many people who have Plan F opt for Plan G instead. They'll switch to Plan G and sometimes save a good chunk of change every year by doing that, okay? Because Plan F has just gotten very costly. Okay, Plan G, you can see it covers, you know, Part A coinsurance. So there's your $1,670, right? And your hospital coinsurance, your $480, etc. So Plan A covers Part A coinsurance and hospital costs, Part B coinsurance and copayments. So not the $185, that's your premium. But the coinsurance that you pay to use your Part B is paid by A. Blood work up to 3 pints. Hospice, coinsurance, and copayments.
Blood work after 3.
Up to 3 pints. That means they will pay 100% for up to 3 pints, and after that, you would pay for it.
But what does that mean, blood work? Like if you need
Blood,
you get 3
I'm sorry, it
Receiving
really
blood
means
product.
blood products.
Receiving blood products.
Receiving blood products.
So if you're in surgery, you only get 3 pints?
No, you may get more than that, but you will pay for it.
Except in Connecticut.
Oh, okay, I don't know Connecticut, but 3 pints is the federal Medicare. Okay, might be different in different states, it may well be, but the federal rule is up to 3 pints. Hospice coinsurance and copayments are covered by A. Plan A does not cover skilled nursing facility coinsurance. So remember, Medicare Part A has coinsurance for skilled nursing days. Plan A does not cover it, but all the other plans cover it somehow. You can see Plan K, L, and M cover a percentage of skilled nursing coinsurance, and the Part A deductible as well. Remember that $1,600 deductible? So these 3 pay a percentage of that. This one pays none of that. So do you see how it works? Different plans pay different coverages for things, okay, and different amounts. So you pick your plan, and then that's what's covered. And again, only what is covered by original Medicare, and then they pick up what they do behind that. Yes?
So the 20%, so they pay 80%, Medicare pays 80%, and the 20% is the co-insurance amount.
No, there are co-insurances, right? So if you're in the hospital, let me see if I can get back there. If you're in the hospital, you're going to pay for Part A $419 for these days, okay? If you're in the hospital a long time, you're going to pay $419 a day. That's your coinsurance, or your copay. This right here, if it's a percentage, like the 20%, that's coinsurance. But that is essentially just what Medicare does not cover, is the 20%. Okay. So this is a deductible. These are deductibles. So every year, $1,676 starts every new year for Part A. And you can see here that this does not cover, Plan A does not cover the Part A deductible. So Plan A costs less than Plan G, because Plan G covers everything except the Part B deductible here, right? So that's a high price plan. It's the most, Plan F is the most expensive. Plan G is the next most expensive, but it covers the most. And then they go from there, and you know, so Plan A would cost less than, you know, Plan B, because Plan B covers the Part A deductible. So if you're hospitalized, it covers that $1,673, okay? So that's how they work. And you pick your letter, and then you price your plan. And so the ones I look at most for people are Plan G and Plan N, because they cover the most. Plan N has some copays that you have to pay, but it generally runs $40 or $50 less a month. So the question there is, how often do you see the doctor? If you see a specialist quite often, you're gonna pay a copay every time. So that might run you $50 or $60 a month, and you're better off getting a Plan G. See, to me, it's a monetary analysis, yes.
How often can we switch it? So once
So
you pick your
here's
stuff, or
here's
can
the
you
other
change
thing. People, you can, in Oregon, there's something called the birthday rule.
it? Okay.
And so on the month of your birth, 30 days before the day of your birthday, and 30 days after your birthday, you can change your Medicare Advantage, your Medicare supplement plan with no questions asked. Okay? But you can change it anytime if you're willing to do medical underwriting. So that means they're gonna ask you health questions, and they're gonna approve you or deny you. So pre-existing conditions come into play, cancer comes into play, you know, chronic disease comes into play as you go back to change your coverage with supplements over time. That's the only opportunity in Oregon that you have to change your supplement every year.
So, Beata, you're saying changing supplement, does this also, take care of the Advantage plan? I mean, it's
No,
not-
that's different. That's a
Okay,
whole
so
different
just
set of
want
rules.
clarity.
So let me say though too, with your supplement, let's say you say, well, look, I don't wanna pay so much for my supplement, so I'm gonna buy a Plan C. That's reasonable to me, covers most stuff, some Part B charges, yeah, okay, I'm gonna do Plan C, see how it goes, okay? Because it's a little cheaper than Plan G and so on. When you go to change your plan, you cannot go up. You can only go down or stay the same.
Okay, what does that mean?
That means if you start with a Plan G, which let's call the highest level of coverage in a supplement, and then your birthday comes and you say, well, hey, well, actually, you couldn't do that. Let's say, okay, hey, I want to stay a Plan G. You could do that. Or you could do any other plan because it's the highest. Okay, but then let's say on one birthday you say, hey, I'm feeling pretty good. I don't have a ton of money. I'm going to go down to an M. Okay. Once you go to M, you cannot go up to N, and you cannot go up to G. So you cannot, on your birthday rule, increase your coverage. You can keep the coverage the same, or you can drop your coverage. Okay? Supplements are pretty limiting in terms of how you can change them, and that's because of the carriers. They have to protect their interests in, you know, making sure that they can sustain their plan. And that requires them, well, yeah, there are profits involved, but also they have to be able to provide for the care that they agree to support in their plan, right? Yeah.
Are you gonna talk about if you have an Advantage plan going to a supplement?
So if you have an Advantage plan, there are lots of ways to go to a supplement. And yeah, I'll talk a bit about that. But yeah, people have the idea that if you get an Advantage plan, you can never get a supplement. That is totally untrue.
That's
You
what people
can,
say.
I know that,
Yeah.
but it is just not right. It is not the rules, okay? You can do medical underwriting if you're healthy enough. I just put an 80-year-old woman through medical underwriting for a supplement. She'd been on Advantage plans her whole life. Woman takes one medicine. Okay? She's healthy as a horse. She got an approval in 10 seconds. Okay? So if you can go through medical underwriting, and you know, she's had a few little things, little skin cancer here and there, little, not melanoma, but basal cell, right, stuff. But she passed no problem. I've put people with diabetes through medical underwriting, and as long as they don't have neuropathy and the side effects of diabetes, they can pass underwriting. Okay, it's not impossible to pass underwriting, so that's number one way. And you can do that pretty much anytime. If you want to not do medical underwriting, then it gets a little more challenging. So let's say you're in a plan, like last year, MODA provided Medicare, okay? They left the county. They no longer do that in Jackson County. The plan left. That's called a service area reduction, and that gives people a guaranteed issue right for a Medicare supplement plan, okay? So there are, you know, an array of ways that people can change from an Advantage plan to a supplement plan as things go along. And that's just two of them. Okay, so, all right, so there you go. I came up with this little rough estimate for 2025. You have your Part B premium, your Part B deductible of $257 on original Medicare. Your supplement plan, G or N, roughly 191 to 300. That's probably gone up a little. It's more something, depending on age, more something like maybe 220 to 325 or so a month for your premium for a G plan. For an N plan, something like 175 to 275 or so. These are really rough estimates. It really depends on you, but I would have to talk to you about it. But you're talking somewhere around here per month. And then you have a Part D prescription drug plan. And if you take medicines, you're probably going to not want a freebie plan that just is a placeholder. Probably going to want it to cover some of your meds. So it's not clear for 2026, but likely, somewhere around $50 a month with a deductible of now $615 a year. So that's the drug plan. So your total is somewhere in the neighborhood of $6,000, $6,067 for option one. And this is really rough, so please don't hold me to this. It's very rough estimate.
Per year.
Per year. About that
And
amount.
we're just supposed to sit here and smile and not be, are you kidding?
No, you can be, are you
What's going
kidding?
on with
Yeah,
the insurance
that's the
companies and big
Medicare
pharma
supplement
and-
plan,
oh
okay?
my God.
All right, so now what we have to do is we have to work with what we have. Okay, we're not going to, in this room, change the whole healthcare system and make it all the way we would like it to be. We can't. So I'm not selling anything here. I'm explaining the way this works, and because I want you to be smart consumers, that's all. If you choose, if you age into Medicare, you're going to be required to make some choices. And they're going to be choices among what's out there. They're not going to be ideas. They're going to be facts in front of you. So I'm just trying to show you kind of what it is. What is the arena you're playing in? Yeah, I have my thoughts and feelings, but I don't go there because then I can't get up in the morning. I can't do my work, So just bear with me here. I just want you to know what it is so you can do your best to play the chess game, okay? And that's how I think of it, okay? So you play the board every year, and I help you play the board. That is what I do to get your best thing. But I work with the tools we're given. I don't create the tools. Okay, so Medicare Advantage is right here. This is known as Part C. It includes most often prescription drug coverage. There are plans that do not include prescription drug coverage, and they're mostly for veterans and people who have TRICARE and other prescription drug coverage that they get, okay? So unless you have that, then you really do need some sort of, as I said, prescription drug plan. And then they often include some extras, although these are being reduced. But they often will include a gym membership. They often, or at least part of one, they will include often some dental, at least preventive dental, teeth cleaning, bite wing x-rays, etc. Some vision, like a vision exam, and maybe an allowance for glasses or contacts. Some hearing, a hearing exam maybe. And then maybe more. I'm reluctant to push I think you buy a plan, or you enroll in a plan, not for extras. You enroll in the plan for the core medical. And if it gets you some extras, more power to you. If you like to go to the Y and you get the Y free, great. But you don't buy the plan because it gets you the Y. You buy the plan, you enroll in the plan because you believe it will meet your medical care. The best of what's out there that you can do. And then next year, you look again. Okay? And you look at your needs again, and you look at your plan again, and you look at the field again, and you say, okay, here's the best I can do. Medicare Advantage is quite flexible, actually. You can enroll in a new plan every year between October 15th and December 7th. It's called the annual election period. December 7th, okay? And so you can change your Medicare Advantage plan every year during that time. Also, if you're in a supplement over here and you have a prescription drug plan, that's your window of opportunity to check your prescription drug plan and make sure you have the best one for your needs given what's in the market, because they change every year, just like Medicare Advantage, okay? So So, also, if you have a Medicare Advantage plan, you can also change your plan between January 1st and March 31st of every year. I call this the lemon law. So you enrolled in something during annual enrollment, you take it on the road, you decide, no, this doesn't work for me. You can then go back and enroll in a new plan until March 31st. Okay? So you can revisit it if you have to. It's not encouraged, but if you selected your best effort and it didn't work, your doctor goes out of network, something goes wrong, you have until March 31st to change your Medicare Advantage plan. So that's actually quite a bit of time.
If I'm seeing a counselor weekly and he's not in the network, like how much would that cost?
Gosh.
If I have a Medicare Advantage plan,
Well, if he's not in the network, you'll pay his fee, his full fee.
the full fee.
Yeah, if he's not in the network. So remember, with Advantage plans, you're working with networks. And here's the other thing about mental health. Many therapists don't take Medicare at all. So even a supplement, even original Medicare, you can't use with those folks. Some do. There are some that do. There are some that take Advantage plans. So again, you have to ask, you have to do your homework, and I help people with that as best I can. Okay, so, but it's not easy. Mental health is not easy in any case with any coverage. Okay, so that's basically how it works. Now, what happens when you enroll in a Medicare Advantage plan? People say it replaces original Medicare. That's not true. You still have original Medicare when you enroll in an Advantage plan. In fact, in order to have a Medicare Advantage plan, you must have Part A and B. You have to continue paying your Part B premium. You have to continue enrollment in Part A and B. So you still have original Medicare, but what happens is original Medicare, which is called the Centers for Medicare and Medicaid Services, assigns your care to the carrier of your Advantage plan, whoever they are. Atrio, United, Aetna, right? Whoever it is, they assign your care to that Medicare Advantage plan carrier. And the carrier submits their plans every year to CMS, and CMS approves them. Yes, this plan covers everything properly. You can go forth with this. Or no, you can't. You have to make these changes because they are required to cover everything that Part A and Part B cover. So the federal government monitors all that. But your care is provided by the carrier, no longer by original Medicare, because they have assigned it. So the carrier gets a capitated rate. They get a monthly negotiated rate to provide for your care. And then doctors who accept you into their practice get a capitated rate for providing for your care. Okay, so Medicare Advantage plans largely kept doctors' offices afloat during COVID when they were closed and not providing any care. They had no billing, and so it was these capitated rates that were keeping them able to have their offices and keep them afloat when they weren't able to provide care. So it actually helped the community quite a lot, and that's just a fact. Okay, so just something to know about these Medicare Advantage plans. But your care then comes from the Medicare Advantage carrier, and that's why you have to know about your carrier. You have to know who they are, how they work, how's their customer service. That's what your agent does for you. They guide you, into the carriers in your area that take your doctors, that take your networks, that hopefully, sometimes they don't, and then you have to make a change, and that's never pleasant. But we just work with what we have the best way we can. And they're all, none of them is perfect. No plan, no supplement, no plan. Original Medicare, none of them are perfect. But actually, they're quite good as a whole. Okay. Medicare Advantage plans do have some extra benefits, and we've kind of talked about that. So let's move on and talk about the costs of of Medicare Advantage plans. You always pay your Part B premium, $185 in 2025, and likely $202.90 in 2026. That's what we think. And you pay low to no monthly premium. So there are plans that are, maybe a $40 premium or a $44 premium, up to, hundreds of dollars premium. And there are zero premium plans. So low to no monthly premium and low to no deductibles. Now in 2026, there are more deductibles on Medicare Advantage plans. And that's something that has happened because of the cost picture in insurance in general. So I don't want to get into that because it's just overwhelming, but you will have co-pays and co-insurance with a Medicare Advantage plan. So when you go to the doctor, you're going to pay, something. Many of them have a zero premium primary care doctor, but if you go to a specialist, you might pay $30 or $35 to see an in-network specialist, and you might pay $60 or $65 in a preferred provider organization to see an out-of-network specialist. So that's an example. Co-insurance is a percentage. So if it's a flat dollar amount, that's a copay. You go to the doctor, you pay $20. That's a $20 copay. If you go to the doctor and you pay 20%, that's a co-insurance. That means you're going to pay 20% of what the doctor bills. Okay.
What about lab?
Yeah, same thing. You'll have a copay or not. I mean, some lab has zero copay on some plans, and some lab has in-network a copay of some kind. Like MRIs in the radiology field, MRIs and CAT scans have a higher copay than hey, go get your elbow x-rayed, right? That would be a lot less. Might be 20, might be 50, could be zero on some plans for just the go get your elbow x-rayed. But if you need an MRI or a CAT scan, that's going to cost, a higher rate. So, and I'm talking about rates now. I'm kind of pulling things out of the air. I'm not talking about any particular plan. Okay.
Does the Medicare Advantage plan pay the Part A deductible?
Yes. Yes, they do. The Part A deductible is part of the assignment in a Medicare Advantage plan. So you're not going to pay that separately, but it might have its own health deductible.
And what about the Part B deductible?
Yes, also, same thing. But again, it might have its own health deductible. So your Part A deductible is hospital, and that's part of the health plan in Medicare Advantage. And the Part B deductible is for medical. And so you could have a deductible in a Medicare Advantage plan as well as, but they're not usually as large as the full Part A or Part B combined would be. And you can see some of the extra coverages. Now let's talk about drug plans. Okay, so the Part D prescription drug plans have, and they often have, thank you for coming.
Thank you.
Often have an annual deductible, which is defined by the carrier in all cases for drug plans. Some don't have a deductible. Many do, especially now they're having more deductibles. The insured, if you have a Part D drug plan with a Medicare supplement plan, it was $590 in 2025. This has gone up to $615 if you have a supplement and a Part D drug plan annually. It's an annual deductible, yeah. But Medicare Advantage Part D plans often may have that high of a deductible, but they could also have a lower deductible or no drug deductible. Okay, so that depends on the plan and how they do things. So you fulfill your deductible stage, and once you hit that dollar amount, you go into the initial coverage stage. And during that time, the insurer starts to kick in money for your meds. Okay, so here you're paying 100% of your medication costs. Here, the insurance company kicks in a certain amount. So what Medicare says is the insured pays 25% co-insurance during the initial coverage stage. 25% you pay for all prescription drugs, covered prescription drugs, up to in 2026, $2,100 a year. Okay. Once you hit $2,100 maximum out of pocket, you go to the catastrophic stage. And the catastrophic stage is you pay zero. So no more copays for medications. If you have a premium, you still pay your premium, but no more copays. So that's how drug coverage works. And then drug plans have a formulary, which is a book of all the meds they cover. They don't cover what isn't in their formulary. You can appeal decisions, okay? But they have a formulary. And those formularies are regulated. They have to include at least one drug in every category, therapeutic category, and so on. So, but there are meds they don't cover, okay? So, and then within the formulary, the meds are divided into tiers. So tier 1 is preferred generics, you know, old, less expensive meds. Tier 2 is generics. They cost a little more. Tier 3 is brand name, preferred brand name drugs. They cost a little more than preferred generics. Tier 4 is brand name drugs. They have a kind of a pricey price tag. You can see by the dollar signs here. And then tier 5 are specialty drugs. So pretty new specialty drugs for specific conditions. Okay. So drugs are grouped into tiers. The lower the tier, the lower the cost. You may be able to reduce the cost by doing mail order or by using a preferred pharmacy. So there are standard pharmacies and preferred pharmacies, and you can know who your preferred pharmacies are and use them, and that will save you some money on your drug costs. But and then there's also a plan that came out in 2025 called M3P, Medicare Prescription Payment Plan. PPP, Prescription Payment Plan. So this is a plan where you set it up at the pharmacy. If you have high-cost drugs that hit you at certain times of the year, right, they will level out the cost and bill you monthly. So it's not a savings, you don't save money, but it evens it out across the year for you. And the carrier bills you on a monthly basis and covers your meds for the year. It's called M3P. So you apply for that at the pharmacy, and once you have it, you can just continue it year to year. But you don't want to use MP3 if your meds are not, are not pricey, because there's really no reason to do that if it's $1 or $2 a month. Yes?
What about donut holes?
Gone. So
it
that
is gone?
went away in
good.
2025, this year.
it did.
Yeah.
What's that?
The donut hole. It was a thing where, there were 4 stages instead of 3. And in between the annual deductible and after the initial coverage stage, there was this thing called the donut hole.
Right.
And frankly, I never really studied it. I knew about it, but it was a period where you paid 100% again
Exactly.
for a period of time until you got out of the donut hole. And then they started contributing again.
Okay.
So, and also the deductible every year during that time was $8,000 for not deductible. I'm sorry, the maximum out of pocket,
Was 8.
and that came down to $2,000 in 2025.
That's good.
Okay, so yeah, I think it improved it, but you can see the drug coverage in and of itself is its own thing, and you have to know how to work with that. And again, that's why working with a local agent who knows the field and the plans that are available in your area is really, really helpful. That's why I did this, folks, because I retired from the San Francisco Department of Public Health, and I looked at Medicare. And I went, what? And, I was like, yeah, I am going to help people with this because this is crazy. So I just dove in. All I do is Medicare. I do not do other insurances. I'm not trying to make a killing. I'm just trying to help people with Medicare. So I do a lot of education and a lot of one-on-one, work with folks. So here's what happens by income bracket. So if you make a high income, your Part B premium increases, okay? So if you are an individual and you make $106,000 or less in a year, or you file a joint return at 212, you in 2025 paid $185. If you made 106 to 133, individual, 212, and I'm not gonna go through all these layers, but you see what happens, okay? If you are a very high earner, you will pay more for your Part B Medicare premium. So just to be aware of that, so you're not surprised by it. And by the way, the government looks back 2 years to your tax return, 2 years. So that's the thing to start planning. I tell people, start planning Medicare when you're 62. So you know how to work with your money to avoid these penalties if you can when you turn 65. Because they're going to look at your 63rd year, 63, to see what you earned. Yes?
And this comes out of what money? I'm like I have Atrio.
Yeah.
And so,
This is Part B. That's your Part B premium. So that comes out of your Social Security.
okay.
Yeah, no matter what plan you have, whether you have a supplement or a Medicare Advantage plan like Atrio or Regents or whoever, you're paying Part B, and it's income based. After 106,000, 212 for a couple, filed married on a separate return, 106 or less each, right? Then that's what you're paying as you earn more. Yeah.
So I am gonna make an appointment with you, but I have a job and I pay like $70 a month for my insurance. I'm gonna turn 65 in June. Should I just keep on my work insurance? It seems
Yeah, there are
cheaper.
rules about that, and what you would do, as long as your work insurance is creditable according to Medicare rules, meaning it's your health and prescription drug coverage through your work are as good as Medicare's standard plan.
Okay.
Okay, so you want to ask your employer that. You go to HR, you say, is our plan creditable for Medicare? If it is, then you can delay Part B enrollment. You don't have to enroll in Part B when you turn 65. You can do it when you lose your creditable coverage,
Okay.
okay?
If I'm under my wife's insurance, but I've been paying, but I haven't received even a card or anything.
So you're saying you're on your wife's insurance and it has prescription drug coverage
Yeah,
and...
I'm a teacher.
Yeah,
Yeah, so you really could avoid paying for Part B. You could avoid enrolling in Part B until you lose the creditable coverage. So you may not have a penalty because you still have insurance coverage.
Yeah.
That's the point, right? So, yeah, so I would suggest though, don't, I mean, I'm just standing here spitballing, right? So I would want to talk with you about your situation
I want to
before,
talk to you.
before making any decisions, yeah, or advising. I don't want anybody to feel advised by this, because that's not what I'm doing,
It
so
just
I can't
seems
do that.
like you
In
are
front of her.
forced to, and I'm glad that I know about you, but it's like, how can the average person figure all this stuff out?
Yes, exactly, and that's my point. That's why it's so important to have somebody in your corner, who's in your corner before you enroll, in your corner when you enroll, and in your corner after you enroll.
When you don't.
And only licensed agents can do that, okay? By law, only licensed agents can do that, so.
Death looks really good right now.
Is what?
Death is looking really good.
Oh, no.
Like a great alternative. Like, look at this. It's cuckoo.
Yeah, so
I believe in the afterlife.
So I talked about the annual enrollment period and the Medicare Advantage open enrollment period, January to March. And there are special enrollment periods also that are based on qualifying events, like if you move or if you lose your work coverage, that's a special qualifying event. Or if there's a disaster declared by the government and you can't get to your agent or your agent can't get to you to help you and you miss the annual enrollment period, you have a special election period, yes.
How long is the moving? Is there a
There are time limits, and I don't want to, because I don't know them all by heart, but yeah, there are time limits on that if you move. You have to notify your current insurer, you have to pick a new plan where you go.
okay.
Okay, so you do have opportunities to change your plan. If you, and I said this earlier, if you start out in a Medicare Advantage plan, you may later be subject to medical underwriting for a supplement. And there are guaranteed issue rights that give you ways to work with that so that if possible you can avoid it. But you might not be able to avoid it. So we have to be clear about that too.
What is underwriting?
Underwriting is medical questions that you answer and the insurer gets to decide. They have people who review it and decide whether you should have an increased rate because of your health conditions or whether they will decline you because of prior health
Do
conditions.
you have to do a special exam?
No, not usually. Usually it's just questions that are asked. Yeah. Okay? So here are reasons that you can change with a guaranteed issue. Okay? You can go from a Medicare Advantage to a Medicare Supplement during the Medicare Advantage prescription drug trial period, which is the first 12 months of your enrollment on a Medicare Advantage plan. Also, if your plan leaves the market, I talked about that, or if it changes its costs more than 15%. So your plan increases its costs to you more than 15%, Medicare gives you the right to a guaranteed issue Medicare Supplement plan. So those are some of the reasons that you can move to a different plan over time. Don't be late. Here are the late enrollment penalties. Part A, if you're not qualified for premium free Part A, and you don't enroll in time when you're 65, you pay a 10% penalty. Most of us are qualified for free Part A, so we'd never pay that penalty. Part B, 10% if you are not qualified for a special enrollment period. So loss of employer coverage is a special enrollment period. But if you just don't enroll and you wait a year, you're going to pay 10% of the monthly premium in addition to the monthly premium. You wait 2 years, you'll pay 20% more. You wait 3 years, you'll pay 30% more. Okay, and that's the top 30%. But 30% of $200, you know, that's a chunk of change on a fixed income over time. Part D, the prescription drug plans. If you don't enroll on time when you are eligible, and that could be loss of employer coverage or retirement and no longer having prescription drug coverage that is creditable, is 1% of the current average premium for each month if you're more than 63 days without prescription drug coverage that Medicare considers creditable. So again, that's a formula. Don't worry about it. Just have prescription drug coverage in some way. There are ways to have it that don't cost much. Especially if you don't take drugs, you can get a zero premium plan or a $5 a month plan. And it just holds it so you have it and you don't get a late enrollment penalty.
What do you know about extra help?
So Extra Help is a Medicare program that is income-based, and it has levels. So, you know, you can be at level 1, which pays, I think, the highest amount of your drug co-payments. So it pays for your drug, it reduces the cost of your prescription medications. And each level has a different reduction and, of course, different income requirements. So you apply for Extra Help at medicare.gov or call 1-800-MEDICARE.
And it's called Extra Help?
It's called Extra Help or Low Income Subsidy. That's what it's called. Good question. Okay, if you delayed enrollment, you can enroll after the last month of employment. So in other words, if you were employed and you had creditable drug coverage, you can enroll, let's say this is the first month after your, this is the month you lose coverage. Okay, so March 31st or November 30th, I lose my coverage. You have 8 months from that date to enroll in Parts A and B. So you have to get Part B within 8 months, and you have 2 months to enroll in either a Part C Advantage plan with prescription drug coverage or in a Part D Medicare prescription drug plan. Because you've got to have the prescription drug coverage very soon. Okay, can't be without it very long, or they start adding up that penalty. Okay, so that's if you delay. A lot of terminology, a lot of buzzwords, you know. So you want to kind of be aware of these. Why use an independent agent? I think it's important to understand. Okay, independent agents charge nothing. You should never be charged for anything that an independent agent does for you. And if they're saying that you have to pay a consultation fee, whatever, don't go to them, because they're not following the Medicare rules. It makes me wonder what else they're not following, okay? So be careful. Once you enroll, your agent is on record, meaning the insurance company has them on record. And they can then help you with issues that may arise with your Medicare, and we talked about that. A billing denial, treatment authorizations, provider access. Your agent is on record and therefore can help you. As a broker, I represent all different kinds of Medicare plans, many different plan carriers or insurance companies. I'm licensed and certified in every plan I represent. Every year, I take 18 exams. And I have to pass every one of them at 85% in order to talk to you about the plan. Okay? So including a national exam that I have to pass at 85% about Medicare changes every year. So this is no small thing. You undertake this because you want to help people, and you know, and it's a lot of work, and it costs to do all that. So therefore, I get a commission, right? I get a commission for what I do. The companies, the insurance companies, yeah. Look, I'm super transparent. I have nothing to hide. I'm here to help people get the best they can, and I do get paid for what I do, yeah. Mm-hmm.
Just, do you get a commission every year, or is it?
You get a commission when you enroll someone who's new to Medicare, who's never been on a Medicare plan, a little bit bigger.
Okay.
They're regulated the same across all the companies, so it doesn't matter who's paying it, but you get a little bit bigger commission, what's called full commission. And you can look it up online. I mean, it's published. It's, you know, the state regulates it, the federal government also regulates it. So then you get a half of that every year that they renew. So why do they renew? They renew because you served them. Because you called them, you helped them check their plan, because you told them there was a problem coming and they averted it, right? You serve them so they stay in your book. That's what motivates people to, hey, keep up with your folks, answer their calls, be available to them.
Can I switch then? So my daughter's, we signed up with someone else and she's not very helpful at all anymore?
Yes,
So I can-
you can. There are some insurance, it depends, really I have to say it depends. On what you have, what plan you're with, but we could talk about that. Yeah, it's possible to do with most carriers, at least with Medicare Advantage. Medicare supplements don't like to do it. Yeah.
So I've been happy with HO, but they just dropped.
Yes,
Santé.
exactly.
Yeah.
And I am helping people navigate that every
You are.
day,
Okay,
every
so
day.
I will talk to you about that. I will
Yeah,
try to
so
get
what
it.
I'm gonna ask you to do, where did I put my book, is I'm gonna pass this around and have you just take one. This is called a permission to contact form. And again, I have to have this to contact you. If these people calling you on 800 numbers, they are violating Medicare rules. And what they're doing is selling you something. They have something and they're gonna tell you you need it. It may not even work in your neighborhood. Okay, so please, I beg of you, me or somebody else,
So I'm
work
covered.
with a
Here's one.
local agent. What's that? You just
Oh,
got one?
yeah. I've been
Yeah.
going
Yesterday.
All those things are really questionable. These guys on television, Joe Namath, what does Joe Namath or William Shatner know about Medicare? I ask you.
you about, like,
Right, JJ,
You're
who
right.
is JJ? Good guy, good times guy?
Good times, got JJ.
That's JJ Walker.
Dynamite.
JJ Walker, right?
Yeah.
What does JJ Walker know about Medicare? I guess I have to wrap up. Oh, no, okay. This is right. So grocery allowance was a thing before, but it is gone, except for people with really severe disabling conditions.
Or agents from India.
Or you mean avoiding?
Oh, if there's customer service, It's a lot of some companies.
No, I'm just saying, I get calls every day.
Oh, yes. Those are call centers that are selling for United or selling for some of the big companies, and they're just hundreds of guys sitting in a room trying to make a living by selling you a plan.
You're saying it's illegal.
I'm saying it's against Medicare rules. It's legal,
Oh,
but it's
really?
against Medicare rules, and I think it should be illegal, in my opinion. But I have a horse in that race, so.